I'm Michaela Miller with the Tuesday edition of the Our City COVID-19 News Show. We will be updating you on the latest information and resources around the COVID-19 pandemic while unpacking deeper issues as they emerge. On the show today, we will be showing you some of the positive initiatives that has arisen during the national lockdown period. We encourage our viewers to get in touch with us. We want to hear from you as we welcome contributions from movements, healthcare providers and our audience. We want this program to be a two-way flow of information, so please get in touch with us via social media platforms and our email. And now for the news. As we enter day 26 of the national lockdown, the current number of confirmed COVID-19 cases stands at 3,300 with 1,055 recoveries and 58 deaths. A truck carrying Checkers merchandise was looted in Bishop Blavis on Monday. It was the second time of the company's trucks was robbed in the same spot. A video shot by Armand Hugh shows a number of residents gathering around the truck as individuals inside frantically handed out goods before rushing off. The police said in a statement that 4 suspects had subsequently been arrested for public violence and looting. In another incident, 4 trucks making deliveries in the area were belted with stones and robbed of cargo. 2 were transporting food parcels to bring relief to Bishop Blavis community of Bishop Blavis. Drivers have been warned to be cautious when visiting the area. Certain routes may be effective due to the situation.
Okay.
Metro Police in Cape Town had their hands full with shopkeepers selling cigarettes and violating South Africa's COVID-19 lockdown regulations. Alderman J.P. Smith said on Monday, officers confiscated 179 packs of tobacco, 918 loose cigarettes and 4,894 packets of cigarettes and 2.5 boxes of cigarettes during the past week.
Our enforcement efforts also show that many shopkeepers continue to sell cigarettes, particularly when one considers the thousands of packs of cigarettes that staff are confiscating either in transit or from shops where people are caught in the act of sale. Even worse is the sale of liquor, where the illegal sale of alcohol in terms of the regulations has been caught many times, either from shebeens operating illegally or from volumes of alcohol being transported to shebeens, and even formal distributors engaged with large delivery trucks in distributing alcohol. This complete contempt for national government's lockdown regulations are extremely problematic. While one has an appreciation of the principles of supply and demand, the reality is that for the moment selling cigarettes and alcohol is against the law and shopkeepers are putting themselves at risk of arrest. It's also noteworthy that we have, in the absence of significant liquor sales, seen a dramatic reduction in trauma incidents at our hospitals across the city.
Provincial Community Safety MEC Albert Fritz has commended the 500 newly deployed law enforcement officers appointed through the Western Cape Safety Plan who are supporting the enforcement of the lockdown. The law enforcement officers working with SAPS and SANDFs in a joint effort to ensure with compliance with the lockdown regulations.
The Minister of Community Safety, Albert Fritz, commends the 500 newly deployed law enforcement officers appointed through the Western Cape Safety Plan who are supporting the enforcement of the lockdown. The law enforcement officers are working with SAPS and the SANDF as a part of a joint effort. Between 6 and 12 April, the Law Enforcement Advancement Plan, or LEAP, law enforcement officers arrested 13 individuals in possession of, dealing narcotics, and in possession of liquor or in contravention of the Disaster Management Act. Issued 625 Section 56 written notices to appear in court in terms of the bylaw disaster management regulations and traffic bylaws. Attended to 291 COVID-19 related complaints. Minister Fritz said, "I wish to commend the 500 newly deployed law enforcement officers who are supporting the Joint Command of SAPS and SANDF. These officers have been deployed in 8 clusters, including Khayelitsha, Lentegeur, Nyanga, including Bishop Levis, and Delft, which includes Blue Downs."
More than 10 million litres of water has been delivered via water trucks to communities living in informal settlements. This followed a picket in March when residents belonging to the Khayelitsha Community Action Network demonstrated outside the Civic Centre demanding that the city provide emergency water supplies during the COVID-19 lockdown. Mayoral Committee member for Water and Waste, Xanthia Limburg, told Ground Up that water trucks had stopped delivering to Site C after incidents in which the contractor and staff were robbed of their valuables. Police in Elsies River are investigating the murder of 85-year-old Inde Muller, who was found in her Reiteweg home on Saturday after suspected burglary. According to reports, SAPS members on patrol in the area responded to neighbors who said they had not seen her since the 15th of April. On arrival, they found Muller's body on the bed. Police spokesperson Captain F.C. van Wyk confirmed that a case of murder was being investigated. Anyone with information is asked to call Detective Captain Stefanus on 021 928 4100. The Metro Police branch in Khayelitsha has been closed after an employee tested positive for COVID-19. Traffic Department spokesperson Wayne Dyson said that the office was evacuated and sanitized and would reopen on Thursday. This brings the number of COVID-19 cases in the Western Cape to a staggering 905. On Monday, Western Cape Premier Alan Winde announced that another person had died. A 48-year-old man is now among the 17 who have died of the virus in the province. Now it's time for an ad break. We'll be back shortly. Welcome back. You are still watching the Our City COVID-19 show with me, Michaela Miller. We will be giving you the latest updates of the COVID-19 pandemic and sharing essential resources and information with you. The World Health Organization warned on Tuesday that any lifting of lockdowns to contain the spread of the novel coronavirus must be gradual. If restrictions were to be relaxed too soon, there would be a resurgence of infections. The Director General stressed that the WHO had warned that the extent of the coronavirus outbreak would take many countries by surprise, including more developed and wealthy nations.
We have spoken previously about the factors countries must consider as they plan to start lifting the so-called lockdown restrictions. We want to re-emphasize that easing restrictions is not the end of epidemic in any country. Ending the epidemic will require a sustained effort on the part of individuals, communities, and governments to continue suppressing and controlling this deadly virus. So-called lockdowns can help to take the heat out of a country's epidemic, but they cannot end it alone. Countries must now ensure they can detect, test, isolate, and care for every case and trace every contact. We welcome the accelerated development and validation of tests to detect COVID-19 antibodies, which are helping us to understand the extent of infection in the population. WHO is providing technical, scientific and financial support for the rollout of seroepidemiologic surveys across the world. Early data from some of these studies suggest that a relatively small percentage of the population may have been infected even in heavily affected areas, not more than 2 to 3%. While antibody tests are important for knowing who has been infected, tests that find the virus are a core tool for active case finding, diagnosis, isolation, and treatment. One of WHO's priorities is to work with partners to increase the production and equitable distribution of diagnostics to the countries that need them most. To achieve that, WHO has worked with FIND, the Foundation for Innovative New Diagnostics, and the Clinton Health Access Initiative to identify and validate 5 tests that have been validated and can be manufactured in large quantities. Working together with the Global Fund, UNICEF, and UNITAID, we have now placed orders for 30 million tests over the next 4 months. The first shipments of these tests will begin next week through the United Nations supply chain we have established with the World Food Programme and other partners. Solidarity flights continue to ship life-saving medical supplies across Africa to protect health workers who are on the front lines in the effort to save lives and slow the pandemic. Over the past week, WHO has been working closely with the World Food Programme to deliver masks, goggles, test kits, face shields, and other medical equipment to 40 countries. This is part of the overarching drive to keep supply chains moving and ensure key supplies reach 120 priority countries. Through April and May, we intend to ship almost 180 million surgical masks, 54 million N95 masks, and more than 3 million protective goggles to countries that need them most. I also want to highlight the JACMA Foundation's donation of 100 million masks, 1 million N95 masks, and 1 million test kits to WHO. We had a very productive discussion with JACMA yesterday, and he would like to continue to support countries in need. We're also continuing to lead research and development efforts. So far, more than 100 countries have joined the Solidarity Trial to evaluate therapeutics for COVID-19, and 1,200 patients have been randomized from the first 5 countries. This week, we expect that more than 600 countries will be ready to start enrolling patients. The faster we recruit patients, the faster we will get results.
Many NGOs have stepped up to assist in feeding vulnerable communities during this lockdown period. Where Rainbows Meet is one of those organizations and is playing a vital role in providing meals for the Vrygrond community. Our reporter Octavian Glovo has more.
Many NGOs have stepped up to provide meals in vulnerable communities. In Vrygrond, where Rainbows Meet, a training and development foundation is providing 3 meals per day for the people of the community, as many of them are on chronic medication and are unemployed.
The first thing that came to my mind when they spoke about lockdown, my concern was what will happen to the community, what will happen to the people who's living on medication, what will happen to the kids. So we've reached out to the various communities, and we've received amazing support from individuals, from businesses, from organizations themselves. It is right across the Western Cape where people come and say, I would like to contribute. If it wasn't for the people itself, we wouldn't have been able to support 1,400 families every day.
Many members of the community have got involved to assist the foundation and educate others in the community about the virus.
We are educating the community and we want community involvement because by the end of the day, this is their community project. So if the community is not involved, then it's not a community organization. So it works in both hands. We give them and then they need to give back to their community. And we're getting involved by educating the social distance and speaking about the danger of being so on top of each other. The sad part about it, it's a process where we have to learn this new development. We are very much close as communities and we enjoy being on top of each other and also the fear of not getting. So it was a process that was built up and getting the community to really also integrate with each other and trying to teach them how to respect one another. Should not just be coming from us, but also that they need to respect themselves as a community.
The foundation also makes masks for those who cannot afford to buy, but also to generate money.
The mask is to help with the community itself, and the mask is also to generate income for the organization at a very minimum fee. But yeah, it's to generate income in order to keep the feeding from not collapsing. We need to generate our income as well, which is on a very, very slow basis.
With the donations they receive and the little money they generate from selling masks, they also assist other feeding programs in the area.
Support 14 other organizations and it's growing by the totals. The more support we get, the more organizations comes. Vrygrond is now in a position where there's 20 feeding stations. So when we are not here during the evening, there's other feeding stations where we support that can really run effectively and make sure that the people have like a breakfast, a lunch and a supper every day.
Octavian Ndlovu for Our City News, Vrygrond.
Community action networks have sprung up in more than 70 Cape Town suburbs. They are in effort by neighborhoods to care for one another during the COVID-19 pandemic. We spoke to Nadia Mayman, administrator of the Bonteville Can, to tell us about the work they are doing.
Hello, my name is Ayanda Nabe, and today we're speaking to Nadia. Nadia will be speaking to us about the Cape Town Together Facebook group and, of course, the other initiatives that they have been active in. So, Nadia, tell us a little bit about this Together Facebook group that you are currently active in. What is it, and when did it start, and what do you want to achieve through this?
Okay, I think I'll just give a little bit of background. So a week before lockdown, a group of public health professionals, community organizations, and activists came together to discuss the need for a rapid COVID-19 community response. The Cape Town Together group was born on that night, and it was clear that while COVID-19 was a health crisis, that a health response on its own would not be sufficient. We knew that organizing across race and class lines in a city as divided as Cape Town wouldn't be easy, but we also knew that we needed solidarity now more than ever. So on March 26th, the President announced the 21-day lockdown, which has now been extended by an additional 2 weeks. While the effect of the lockdown and the spread of the virus remains to be seen, it was just important for us to start organizing community in a coordinated form.
Okay, so when you say you're organizing them, what exactly do you do? What kind of little projects or, these activities that you do, what are they? What activities do you do?
So Cape Town Together is made up of self-organizing neighborhood-level initiatives known as community active networks. So each can operate autonomously, identifying their members, mapping the needs and the resources in their neighborhood, and linking up with existing community structures where appropriate, and developing a neighborhood-specific response to COVID-19.
Mm-hmm.
According to our stats, we are 2,100 individual volunteers currently on the Cape Town Together group, and we've got 110 community action networks.
Mm-hmm. So these volunteers, you said, are organized across the different communities. different racial lines, across the different racial lines, across the classes. What exactly have you done thus far? If you could give us an example of actual things, actual programs that you've implemented, or actual activities. Now, we understand that the communities, the different cans identify the needs of the communities. And then what? Do you deliver on these needs? What then happens?
Well, the first immediate response for many of the communities was bringing food relief to our communities, right?
Yeah.
So you've got in the community action networks, you've got communities that are better resourced than others. And what the Cape Town Together group has done, they have now partnered better resource communities with less resourced communities. Like in the case of Buncheovo, for instance, we've been paired with the Rondebosch can, and they try and assist us with basically getting some much needed resources to the area. But that is not the basis of the pairing. It's not just of what the pairing community can provide to us financially or in goods. We also share ideas, we exchange ideas, they assist us, they would send us links of where we can apply for instance, food parcels, etc. So it's basically a mutually beneficial arrangement between fans. One would be more resource than the other, but we are both communities are learning at the same time.
Okay, now that's great. I've read on your Facebook page, you talking about delivery of water tanks and activities in Bonteheuwel. And we've seen how some of these programs implemented by government have seemed to fail, whether it's due to criminal activity or otherwise. But I just want to know from you, if you could let us in, how have you made sure that, whatever it is that you deliver to communities? In fact, first I want you to give us a brief idea. What we read on Facebook, is it true, what you deliver in these communities? And how have you made sure that you eliminate the criminal activities when delivering such programs?
Okay, so I can't speak for other communities. I can speak for the Bonteheuwel community and how we've been operating in our area.
Okay.
I can speak a little about how Rondebosch is doing collections because we talk to each other all the time. But organization differs from community to community. So in Bonteheuwel, for instance, our immediate response was to start a fund to get a loaf of bread to communities on the ground. What we have done, we have we've mapped all our streets in Bonteheuwel, and Bonteheuwel is designed in such a way that all the A streets are grouped together, B streets, so we've got the A block, the B block, and so forth and so forth. So we've identified a champion on almost every street. So in the 120 streets that we've identified, now it's not 120 streets to say, it would be 108 streets, but all the streets are so long that we've broken them up for the sections like our main road, Bonteheuwel, that goes right around Bonteheuwel. It doesn't make sense to have just one champion in the street that is as long as Bonteheuwel Avenue. So we've got 3 or 4 champions alone. So we have about 80 champions. Of that 80 champions, 20 of them are also cooks who have in the streets. So these champions have to identify the most needy and vulnerable in the we've got a database of about 500 most vulnerable families, and this is growing on a daily basis. So we started with our bread drive. We started on day 1 of lockdown with only 40 loaves of bread. That has escalated to now we are in the fortunate position of being able to distribute 400 loaves of bread every single day. So 10 loaves of bread is delivered to the champions in our street, and those champions make sure that each vulnerable family in the street gets a loaf of bread, and if the 10 loaves are not enough, champions make sure that they have a rotation table so that each family will at least have a loaf of bread on every second day. In addition to that, we have managed to get donations to make about 250 food parcels. Those food parcels were delivered by our coordinators directly to families, where we also assessed whether these families were really the most needy of the needy in our area. In addition to that, we've also identified that with all the learners being at home and learner packs being made available online, not a lot of our community members have access to internet or social media. So we got branched out of our community active network group, our learner support group. So our learner support is looking at getting learner material to learners delivered to their houses where learners don't, or parents of the learners don't have access to internet.
Mm-hmm. You know, that is so interesting, Nadia. It makes me want to feel like living in Pontyville. Is there room for me by any chance? But anyway, Nadia, thank you so much.
There's a lot more happening.
Mm-hmm. And I'm sure there is. You know, people can follow.
But I don't know if
I think, Nadia, maybe we should just channel people to your Facebook page. If they're interested, if you could give us your Facebook address. Is it a Facebook address or Facebook handle? Facebook address, so that the viewers can know where to follow you in the event that they are interested.
Okay, so are we talking following on the Cape Town Together group?
Yes, absolutely.
Okay, I don't have that link readily available.
Okay, what we will do, that's all right. What we will do, our cast will prepare and present, and in fact, the link will show at the bottom of our screen as we are speaking. And we encourage every member of the community to really go into it and support this program or initiative. And of course, what we've learned, Nadia, is that it is very important to be active in your community. We cannot sit still in times of crisis. In fact, we should not sit still at any point. We need to organize, organize, and organize. Nadia, I have to thank you for your time. Until next time, Nadia, thank you very much. And to the viewers at home, see you next time.
We are taking a short break. When we come back, Octavian Glover will update us on what has the nation buzzing on social media.
Welcome back. Before the ad break, we had Michaela Miller with the latest news. The following video comes to us from the Khayelitsha Community Action Network.
Singabahlali basekhayelitsha abaxhalabileyo ngale ntsholongwane icorona, izinga labantu abosulelekileyo lenyukile kwaye liyaxhalabisa kakhulu.
Kodwa akumelekanga nipenike, nto nje into ekumele niyenze kukumamela imiyalelo karhulumente yokuzikhusela ngandlela zonke.
Sisicelo ukuthi sonke kwindawo esihlala kuzo ukuba sithathele ingqalelo lentsholongwane yecorona.
Xa silandela imiyalelo nemiqathango singakunqanda ukunwenwa nokusuleleka kwale ntsholongwane.
Le ntsholongwane yosulela lula kakhulu. Masizikhusele kuyo, sikhusele nabanye abantu ngokuthi silandele imiyalelo karhulumente.
Le ntsholongwane ihlala amaxesha amade entsuku kwiindawo ngeendawo.
Ngoko uyakwazi ukosulela nokosuleleka xa ubamba izinto nendawo endlini yakho naxa ubamba iindawo eziba nabantu abaninzi. Ukumela kude kwabanye abantu nokungabambani ngezandla kuyanceda.
Kubalulekile xa ukhohlela usebenzise umphakathi wengqiniba ngeli hlobo.
Zama kangangoko unako ukuzikhusela ukuze ungayifumani intsholongwane i-coronavirus ngokuthi ungabambi ubuso bakho
ingakumbi umlomo, impumlo kwakunye namehlo.
Hlamba izandla zakho for 20 seconds ngamanzi nesepha.
Siyayazi kwindawo esihlala kuzo kuba amanzi afumaneka nzima okanye awekho. Lo ngumcelimngeni esithi urhulumente makawulungise.
Kodwa xa ukwazi ukuwafumana amanzi nceda uhlambe izandla zakho kaninzi ngosuku.
Sikhathalele, sikhusele nabantu abasemngciphekweni wokugula kakhulu, njengabantu abadala abanamashumi amathandathu ukwenyuka, nabanye ke abanezigulo ezizezini.
Masikhathalele nabantwana, singabayeki badlale phandle, siqinisekise ukuba nabo bayazihlamba izandla zabo.
Zama kangangoko unako wena nosapho lwakho nihlale endlini.
Masizikhwebule ekupapasheni ulwazi olungenanyani kwaye sihlukane nezimvo zokuba utywala buyayibulala intsholongwane le. Abuyibulali intsholongwane.
Xa uziva unefiva, ukhohlela, unomzimba obuhlungu, unomqala obuhlungu, funa uncedo, utsalele inamba yasimahla engu-0800 029 999. Ndiyayiphinda inamba ngu-0800 029 999. Uxanduva lwam, uxanduva lakho.
Lixanduva lethu sonke ukuzikhusela, sikhusele naye wonke umntu.
Since the lockdown came into effect, it seems animals are enjoying the freedom of not having any humans around. This video of penguins casually walking the streets of Cape Town has gone viral on social media. Recently, images of lions napping in the middle of an empty road in the Kruger National Park took the world by storm. And now for social media. Share your thoughts with us on Facebook, we are Our City CT, and on Twitter at Our City CT. This is a time that we need to come together as a nation. These are the popular hashtags on Twitter today. President Cyril Ramaphosa. The president addressed the nation again tonight. And Twitter is having fun, saying whenever Cyril Ramaphosa says fellow South Africans, it means we're getting some news, but not sure if it's good or bad. 19 South Africa. A group of 19 doctors have signed a letter appealing to President Cyril Ramaphosa to lift the lockdown. They believe a hard lockdown will cause more harm than the pandemic itself. Kim Jong-un, North Korea's leader, recently failed to appear at an important national celebration, leading to speculation as to where he was. Now, it seems he had surgery, with some news outlets reporting he is gravely ill, but resources tied to the country deny he is ill or that he's had heart surgery. The speculation continues. If you want to be part of this conversation, you can do so by visiting our Facebook page using the hashtag #CTVCOVIDShow. After the break, we'll be crossing back to Michaela Miller, who will share information on resources and places of safety that you can use during this period. Stay with us.
Welcome back. You're still tuned into Our City, the COVID show with me, Michaela Miller. Before the ad break, Octavian Glover looked at what has the nation buzzing on social media platforms. For your latest news around the COVID-19 pandemic and to see what other Cape Townians are doing to keep safe, tune into Cape Town TV daily. Speaking about what Cape Townians are doing, here are some organizations helping communities stay safe. Tears Animal Rescue is stepping up during lockdown by doing donation drives and distributing pet foods to owners living in vulnerable communities who are struggling to feed their pets and are in dire need of assistance. The organization has launched an urgent COVID-19 pet food appeal to Cape Town-based manufacturers to donate their surplus edible pet food, which will then be distributed where it's needed most. You can get involved by contacting them on 021 785 4482 or email tears@tears.org.za. A Cape Town-based school feeding organization is putting food on the table for thousands of poor households during the lockdown. The Peninsula School Feeding Association is donating 9,000 food parcels to families in the Greater Cape Town area. You can get involved by contacting 021 447 6020 or email info@psfa.org.za. For those battling with substance abuse, call the numbers on the screen now. Please access assistance from the following community support groups, most of whom are offering online meetings. That's all we have for you today, but if you have something to say, we want to hear from you. Send your comments, news and questions to us via Facebook at Our City CT, on Twitter at Our City CT, or you can get in touch with us via our email on ourcity@capetown.tv.org. This is a time that we need to come together as a nation. So if you're not sure about something, send us your questions and we'll try to find the answers for you. You can also call us on 021 448 0448. From me, Michaela Miller and Octavian Glover, goodbye.